So today I will share about preparation in final months before tagging. Okay, because there's a new batch of HO coming into the workforce. Okay, um, so inshallah within 30 to 40 minutes. Okay, I will share with you all about first, flow of work in your ward. Okay, so kalau nak tahu nak prepare tagging tu macam mana, kena faham lah tagging ataupun kerja dekat ward tu macam mana. So kita akan tengok contoh flow of work in the ward. Okay, so daripada pagi sampai habis shift tu biasanya apa yang kita kena buat setiap hari sebagai houseman dekat ward. Okay, so next kita akan tengok, so kalau first day tu adakah tugas kita sama macam senior houseman. Okay, so apa yang berbeza lah. Okay, and next is road to HOship. So dah tahu waktu tagging nak buat apa. So kita akan tengok daripada lepas e-houseman, waktu PTM, okay, waktu hospital orientation, apa yang kita perlu buat lah. Okay, ada antara points yang saya akan share ni, saya dah share dalam teaching session sebelum-sebelum ni. Okay, tapi since ada intake baru, dan tak ada masalah kalau kita dengar beberapa kali so that kita lebih jelas dan faham lah. Okay, so next kita akan go through 5 core skills and knowledge for tagging. Okay, apa skills yang penting, knowledge yang penting yang perlu seorang taggers ada. Okay, and last but not least, what are good attitude as houseman lah. Okay, sebab bila kita baru sebagai sebagai taggers ni, mungkin kita punya knowledge and skills tak berapa banyak lah berbanding senior houseman. Tapi kalau ada good attitude, insyaAllah you will adapt better lah. Okay. Okay, so let's go to the ward routine. Okay, so apa yang kita kena buat setiap hari sebagai seorang houseman. Okay, so saya bagi contoh untuk, ini contoh ward routine in medical department Okay, so kalau houseman dia kerja AM shift, okay, so biasanya AM shift kena punch in before 7 AM in the morning, but usually kita akan datang lebih awal lah sebab kita nak buat around, nak tengok case, nak ambil darah apa semua kan. Okay, so usually okay, we will start our day with daily blood taking or morning blood taking. Okay, and then kita akan start buat kita punya AM review atau round lah. Okay, so basically waktu kita buat round ni, kita akan tanya patient, okay, so macam mana daripada semalam sampai sekarang, apa dia punya active complaint, okay, dia punya vital signs macam mana, do a relevant physical examination, and then you have to trace the latest investigation, okay, and do formulate plan of management lah based on patient punya condition. Okay, so take note that AM review atau AM round ni you have to cover beberapa patients lah, okay, depending on your department. So kalau medical, usually you will need to do rounds or review for 10 or more patients. Okay, ONG dengan medical biasanya ramai patients. Okay, tapi kalau you dekat pediatric, surgery or ortho, usually lesser lah, maybe half of that. Okay, and then lepas you do your own round, means you assess patient on your own, then your MO will come and you will need to present the findings, okay, and the summary of patients yang you dah review tadi. Okay, so you present to your MO, okay, and then MO will confirm you punya plan of management. Okay, and then round with your specialist and consultant. Okay, so depending on your ward, okay, ada department, ada ward yang MO datang dulu baru specialist datang, ada yang MO dan specialist datang sekaligus. Okay, dan masa diorang datang pun berbeza-beza lah. Okay, ada MO dan specialist datang agak lewat, okay, pukul 8, pukul 9, tapi ada certain department yang specialist dia datang awal, pukul 7 pun specialist dia datang buat round. Okay, so you have to adjust, you have to know this workflow at your department so that you can adjust your work accordingly lah. So kalau specialist datang pukul 7, MO mesti datang lagi awal, houseman pun perlu datang lagi awal lah untuk settlekan morning round. Okay, so that is one example of how to be flexible as houseman. Okay, nanti bila you dah masuk department ataupun before you masuk department, lepas tahu first department tu, okay, these are the things that you need to ask from your senior houseman. Okay, okay, and then bila habis round pun depending on how many patient you have in a ward. Okay, how many whether you the cases in your ward are complicated or not. So usually around 11, okay, 10 or 11 round dah habis, so usually MO and specialists will go to run their clinics or go to OT. So houseman lah, only houseman will stay in the ward to carry out the plans, okay, given during the round. So apa usually post round plans ni, any new blood taking, any procedures, referrals to other department, okay, requesting for scans, for example ultrasound, CT scan, MRI. Okay, if you are in surgical based department, okay, you need to post case to NS team. Okay, kalau ONG, ortho, surgery, kena post case dekat NS lah. Okay, okay, and then okay, in between that you will have new admission, so kena clerk case. Okay, lepas tu ada patient yang transfer daripada different other wards. Okay, for example ada patient balik, kalau surgical based department, patient balik daripada OT, kalau ONG patient balik daripada labor room. Okay, sometimes you have patient transfer into your ward from ICU, so you need to review those cases juga. Okay, sebab dia baru masuk dalam ward, kita kena pergi attend dan assess patient lah. Okay, okay, and then along the way you need to attend or resuscitate unstable patient. Okay, kalau ada patient yang ada complain macam chest pain ke, ada temperature spike. Okay, so you as house officer, you are in the ward, so you need to attend and manage these cases accordingly. Okay. Okay, next usually at 2 PM you will have your PM round. Okay, so usually PM round ni kita akan buat terus bersama-sama dengan MO lah. Okay, dan MO akan datang terus pukul 2, dan sebab kita dah tengok case pagi tadi during AM round, okay, usually PM round are very brief lah. So apa investigation yang kita order pagi tadi, result dah balik ke, how was the result, all the scan request, the referral, what are the outcome lah. Okay, kalau dah buat scan, kalau you dah refer to other department, and what was the output, the input from the other department. Okay, okay, and then not to forget you will have your teaching session. This is your continuous medical education, and sometimes your assessment as well. Okay, so usually if AM shift, it will end at 5 PM. Okay, but you will have extended shift juga. So extended shift usually 7 AM in the morning till 9 PM. Lama sikit lah. Okay, okay, and then okay, so what is the difference? This is the usual ward routine lah in the wards. Okay, so hari-hari this is the flow of work in the ward. Okay, so what will happen in your first day of tagging? Okay, so what will happen in your first day of tagging is, okay, first day of tagging ni lepas you habis hospital orientation. Okay, bila you hospital orientation, okay, you dapat tahu you punya department mana. Okay, so usually towards the end of your hospital orientation lah. Okay, so ada weekend off before the next working day, baru kita report duty dekat new department. Usually you will report duty to the new department on the first working day of the week. Okay, so during the first working day of the week, so usually this is Monday or Sunday in some states. Okay, so kalau you report duty daripada hospital orientation tu, mereka akan bagi a logbook, or certain department you have to print out the logbook from KKM punya website, and then you kena report duty pagi tu dekat klinik, office department ni biasanya dekat klinik. Okay, so kalau you dapat medical, you have to report duty to MOPD. Okay, medical outpatient department or clinic. Okay, so biasanya kita report duty pukul 8, kita akan jumpa kerani jabatan, and then biasanya kita kena jumpa either HOD or specialist yang in charge houseman lah, okay, for some briefing, and then dia akan bagi you punya ward lah. Contoh kalau you dekat medical kan ada banyak ward, okay, so that specialist in charge houseman, okay, dia akan bagi tahu, okay, waktu tagging ni ataupun the first week you dekat ward mana, the next week you dekat ward mana lah, okay. So biasanya dia orang akan allocate houseman dekat ward yang kurang, dia orang akan allocate taggers dekat ward yang kurang houseman lah, okay. So after the briefing with the specialist or the head of department, then you pergi pada ward yang disebutkan tadi, okay. So usually bila kita sampai ward tu is around 9, 9:30 or 10, okay. So 10 AM in the morning, kalau you reach to the ward, so biasanya diorang tengah buat apa, okay. So biasanya you kena, waktu tu tengah pukul 10, pukul 9, pukul 10 tu biasa tengah round lagi lah, okay. Tengah round dengan MO and specialist. So you come into the ward. So what you need to do is you join the round lah, okay. So bila you join the round, okay, usually kalau tiba-tiba ada orang baru, okay, you ada new people there. So please introduce yourself lah, okay. Just mention that I'm a new houseman. My name is Liana. This is my first posting, okay. So that people know you are a new team member, okay. So for the rest of the day, okay, you are another houseman in the ward, okay. So you will need to help carry out plan. So kalau ada new cases, biasanya senior houseman akan give chance to the taggers to clerk so that they can learn how to clerk patients, okay. So kalau ada patient yang collapse atau active complaint, okay, you can learn how to attend these cases, okay, these patients, okay. And PM round, okay, you can take some patients to do your round lah. Sebab first day ni basically you don't have your own patient yet on the first day, okay. You akan ada your own patient on your second day. Sebab second day you akan datang awal pagi macam senior houseman lain lah. So when everyone do their AM round, okay, you will have your own designated patient or cubicles to do your rounds, okay. So basically when you are taggers, your job scope is the same as senior houseman. What a senior houseman need to do, okay, so you need to do as well, okay. The only difference is that senior houseman dia balik pukul 5 petang kalau dia normal shift, normal AM shift, okay. Kalau extended shift, okay, cash window ask what is extended shift. Extended shift means it is a long shift, okay. So kalau usual AM shift, you clock in before 7 and you can punch out after 5. So extended shift usually 7 AM to 9 PM, okay. Dia lebih lama lah, lebih panjang, okay. So usually in 1 week you will have 1 or 2 extended shift, okay, depending on number of housemen you have in the department lah, okay. So kalau taggers, okay, the only difference is you balik lambat, hari-hari you balik pukul 10 malam, okay, because you need to learn more things because you are new in the department, okay, so that you have extra hours to learn how to clerk case, attend patients, okay. And the other difference is when you are tagging, you always have senior houseman with you, okay. So kalau siang ni senior houseman lain semua adalah dalam ward, okay. So walaupun you nak buat you nak buat PM round, you nak request scan, okay, sebab you dah ada you punya patient kan, day 2 and onwards you akan in charge of patients, mungkin half cubicle, mungkin the whole cubicle kalau tak ramai senior houseman kan. So bila you in charge of a cubicle means kalau ada 6 patient, you have to do a M round for all those 6 patients. Bila MO datang, you have to present those case to your MO to your specialist. Okay, so kalau ada plans untuk semua patient yang dalam you punya cubicle tu, you are responsible to execute the plan. Cuma sebab you baru, ada senior houseman, you can ask their help lah or their guidance. Okay, contohnya macam mana nak ambil ABG, kalau you tak pernah ambil ABG, where to read the ABG, okay. How to do discharge summary, okay. And after 5 pun, okay, you will stay in the ward, okay, sebab you nak tagging kan. So you will have ada houseman yang kerja extended shift atau kerja on night shift, okay, they will be around, okay. So kalau you tak sure of something, you can ask them lah, okay. So basically during tagging ni, you punya job scope is the same like senior houseman. Okay, all the procedures yang senior houseman perlu tahu buat, you need to learn, and towards end of tagging, okay, you should be able to do all these procedures, okay, and clerk common cases in your department. Okay, so okay, and then pass over before you go back lah. Okay, so these are 5 core skills for tagging, okay, and also 5 core knowledge. Okay, if you're overwhelmed with tak tahu lah nak buat apa dan nak start houseman lagi few weeks ni kan, at least you focus on this, okay. Okay, 5 core skills what you need to know how to do is, first is what to ask patient during clerking and review, okay. When you clerk new case, a new case come to you, what are the questions you need to ask, okay, during clerking or history taking. And when you do round, what are the things you need to ask patient to assess their update lah or progress, okay. So next, you need to know how to write all these findings, okay, yang you clerk, you review, okay. The 4D SOAP is the format of recommendation of review. Venom's formula is how to plan management, okay. So you need to learn how to document your findings, okay. And nak tulis-tulis ni memang houseman banyak tulis-tulis lah, okay, including how to fill in important forms, okay. And next, okay, after document, you need to be able to communicate your findings, okay. So case yang you dah clerk tadi, you dah review, you need to be able to present those case to your MO and specialist during rounds, okay. And you need to be able to communicate in form of referral to another team, okay, another department, and also how to do a request, okay. So a scan request lah, okay. So USSA is our formula of presenting case. ISPAR is our formula of requesting case, okay. So we will cover more in the advanced pre-HO lah, okay. Okay, and then another skills that is important, and it will be part of your off-tag assessment and of tagging log or tagging form is common procedures, okay. So the general procedures untuk you start dekat mana-mana department pun, the common procedures are venous blood taking, IV cannulation, IV line, arterial blood taking, continuous bladder drainage, okay. So this is common in all departments, okay. And you have procedures specific for that department. Contoh ONG, you will need to know how to apply CTG, okay, interpret CTG, deliver, do vaginal examination, placenta delivery, okay. So those are common procedures that you need to learn during tagging, but it will be helpful if you already practice or revise all this before you start tagging, okay. Sementara ada masa ni lah, okay, so that bila you start tagging tu, it won't be too overwhelming for you to learn everything from zero, okay. And bila dalam ward ni pun dia bukan macam kita kat universiti, okay. Dalam ward ni all other staff are focused on managing patient, okay, settle all the ward works, okay. So kalau ada taggers ni, teaching taggers will be our additional work, okay. So kita kena dahulukan our main work first. Okay, so if you can help with simple things like you can fill in common forms, okay, you can do basic procedures macam blood taking, okay, CBD insertion, that will be extremely helpful. Okay, then kalau you dah pernah practice all these procedures, atau you dah pernah buat, okay, bila orang lain tunjuk, okay, you akan lebih mudah faham dan ingat lah. Okay, so tak perlu tengok banyak kali. Okay, and then physical examination, this is important as well lah, because when you clerk patient, when you review patient, you need to do a relevant physical examination, and physical examination also will be part of your assessment, a formal assessment through your mini clinical evaluation. Okay, so now let's go tadi skills. Okay, skills, clinical skills that you need to have. Now is the knowledge, apa yang you perlu tahu before tagging. Okay, so first is common medications. Okay, common medications and how to prescribe. So you need to know the dosage, you need to know the the form of the drugs. Okay, indication and contraindication as well lah. Okay, for you to safely prescribe the medications. Okay, and next is the common diseases for each department. Okay, yang ni you boleh go through the HO logbook. Okay, boleh, kalau sekarang tak dapat posting lagi, you boleh download daripada KKM punya website, or dekat saya punya Telegram channel pun ada. Okay, so for every disease, common diseases, you will need to know what to ask and what to assess during clerking and review, and how to formulate plan of management based on the venoms formula. Okay. Next is common investigation interpretation. Okay, so apa common investigation that HO need to interpret on daily basis? Okay, this is CTG in your ONG, chest X-ray, ABG and ECG as well. Okay, so chest X-ray, ABG, ECG, in all department you will encounter this lah. Okay. And next one is your normal lab values. Okay, so yang ni tak ada options lah. You need to try to remember by heart. Okay, what is normal value of full blood count, renal profile, liver function test. This is the most common lah. So ABG pun sama. What are the normal values? Okay, and then common abbreviations. Okay, common abbreviations ni short forms. Okay, so you need to familiarize them. Kena biasakan lah, sebab ni bila bekerja nanti we will document. There was a lot of short forms in case note. Okay, there are a lot of short forms during presentation. Biasanya kita akan pakai abbreviations. So kalau you tak familiar, nanti you akan lost lah, atau you tak boleh appreciate all the case notes. Okay, so during these final months of tagging, you can focus on this. Okay, so what Medical can help is, okay, we practice these common skills and knowledge. Okay, so kita bukan macam bagi tahu je lah. It will be two-way discussion, especially in our online live teaching. Okay, for the department. Okay, so we have a pediatric online course, dah nak masuk final week out of 5 weeks. Okay, and we just started ONG and orthopedic soon. So, okay, so kita akan practice how to clerk, how to review, what are the common example of documentation, okay, how to present this case. Okay, and along the way you will see what are the common diseases. We will practice how to interpret the common investigation. Okay, so along the way you will remember the normal value as well. Okay, so bila kita discuss case tu, okay, you will familiarize yourself with the common abbreviations. Okay, so okay, I would like to share something. Medicorp is having our new HO intake sale starting today until this Sunday. Okay, so okay, so you can enroll to our courses, okay, with discounted price. Okay, so some of you ask what we cover in each course. So basically pre-HO essentials is the overview of housemanship lah. So why you need to complete housemanship, okay. What is flow daripada, macam saya mention tadi very briefly, okay. In pre-show essential I will explain in more detail how to what to do in every steps, okay. So you will understand what is what you need to do during tagging dekat ward macam mana, tagging dekat OT macam mana, okay. What else, common medication, common diseases, okay. So I akan explain satu-satu lah macam mana what you need to do, okay. This is general overview in pre-issue essentials, and pre-issue advanced is how to execute every task, okay. So maksudnya club patient ni macam mana, review patient macam mana, okay, present case macam mana, request scan, buat referral, okay, buat discharge summary, okay. So ada case discussion and we have some practice as well. So depends lah kalau you rasa you lacking at which point, which part, then you can decide, okay. Medical emergencies and ABG, we cover common emergencies that HO need to attend in the ward. This is kalau patient hypoglycemia, patient high BP, okay, what you need to do, okay. Patient desat or have low SpO2 in the ward, or patient collapse, okay, we explain step by step what you need to do as houseman, okay. And for professional development, these are work-life balance during housemanship, important points in financial management, and also your career pathway, okay. Okay, so dah tahu kan the 5 core skills and the 5 core knowledge, okay. So selain daripada skills and knowledge, I think what's more important is your attitude lah, okay. So your attitude, sebab usually kalau houseman yang ada isu ataupun ada problem ni, biasanya the issue come from the attitude lah, okay. So what are good attitude for houseman, okay. So first we need to be humble lah, okay. So when you are new in the ward or in the department, you should introduce yourself to other people, okay. Then try to be helpful, okay. Walaupun kita baru, tapi ada benda yang kita boleh tolong lah, okay. Macam fill up forms, kalau you tengok you punya senior houseman MO nak buat procedures, you can be a chaperone, okay. So you chaperone ni you observe, you can assist, okay. So if you can help to prepare things, contoh untuk buat blood CNS, buat CBD insertion, kalau you nak pergi clinical skills workshop tu, diorang dah tahu apa things to prepare, so that will be extremely helpful, okay. So if you help us, okay, you dah tolong prepare barang kan, so I'll be happy and I will have more time to teach you during the procedures, okay. And next is be proactive to learn. Okay, ni ramai houseman baru, kadang-kadang kita takut. So bila kita takut nak tanya soalan. Waktu orang kita duduk kat belakang. Most of the time taggers ni dia tak introduce themselves to the team pun. Okay, so when you don't introduce yourself, kita tak tahulah, oh you ni siapa, you ni baru, kenapa tiba-tiba ada orang baru, medical student ke siapa dia ni kan. So you need to introduce yourself and show some interest, okay. Maksudnya waktu rounds tu, try to involve in the discussion, okay. Try to see how your senior houseman document findings, okay. So macam mana apa yang MO apa yang MO discuss dengan specialist, okay, you need to document, okay. So that is an extra skills yang kita tak perlu buat waktu medical student, okay. So you need to observe, you need to be in the discussion, baru you can get that skills lah, okay. Okay, and most importantly, you need to be responsible, okay. In case you tak sure, you tak tahu, you need to ask, okay. You need to ask and make sure you learn lah, okay. So don't jangan tiba-tiba hilang daripada ward, uncontactable. This is what we call missing in action lah, okay. If you are afraid, find someone to talk to, okay. If you're not sure, find someone safe to ask questions, to ventilate your findings, okay. This could be someone in the department ataupun someone remote lah, okay. You boleh tanya any of your senior in hospital lain ke yang you rasa safe to share what you feel, what you need to ask. Okay, tapi kalau berkenaan patients you, and okay, patient tu nampak tak stable, dia tak tahu nak buat apa, you need to ask there and then. Okay, so it could be quite overwhelming bila start houseman ni. Okay, that's why masa yang ada sebelum tagging ni, okay, you should use it wisely. Okay, saya tahu you all sibuk prepare documents. Okay, but the more important preparation is yourself. Okay, okay, so this is your flow from e-houseman. Okay, dah settle dah. Okay, so saya dah share mentorship forms. Okay, so kita dah tengah baru start mentorship revision. Okay, so you have a lot of time to revise. Okay, and you boleh ask questions to your senior houseman in the WhatsApp group, tanya what to expect from your hospital, what are the things to prepare, department mana yang tak cukup houseman. Okay, and then your PTM. Okay, PTM dah tahu date kan, 4 to 7 April. Okay, and then your hospital orientation will varies. Ni pun boleh tanya senior houseman berapa hari hospital orientation, apa yang diorang cover. Okay, and then your first day of working is tagging lah. Okay, so usually tagging is 2 weeks before you go into your actual shift. Okay, maksudnya ni dah macam senior houseman lah. You punya jadual macam senior houseman, you punya job scope semua macam senior houseman. Okay, okay, I think that's the end of my presentations. Okay, if you have any questions, boleh tanya dalam chat. Okay, if no questions, okay, thank you for watching the sessions. Okay, I hope this session have given you a better insight on understanding what is expected from you as a taggers and what to expect juga. Okay, and most importantly is what you need to do to prepare yourself. Okay, so you boleh reflect lah what are the things yang saya mention tadi yang you rasa you are lacking, then you can work on that. Guna silang, you tengok you punya offer letter. Okay, offer letter ada date PTM kan? I might be wrong. Okay, okay, Anna Karina, if by chance we have a busy day, lots of referral, discharge and lot of patient, only few houseman. Oh, kalau tak sempat settle everything during PM round. Okay, so kalau memang ward busy, lepas tu houseman tak cukup, MO will understand lah. Okay, that you might not be able to settle everything. Okay, tapi sebab MO dah tengok case tu waktu pagi tadi, so usually they can you can do the PM round together with them. Okay, tak ada issue lah. Okay, the issue is kalau patient tak ramai pun, houseman ramai tapi PM job list tak settle lah. Okay, that will be an issue. Okay, otherwise usually with a good teamwork, tak ada issue untuk kita settle everything lah. Okay, I think that's all. Thank you. See you in our next teaching session.